Hey everyone, and welcome back to Azeem USA. Today, we're diving deep into a topic that's been making headlines and, let's be honest, causing a bit of a stir: the Marburg virus. You've probably seen the news. Recent outbreaks in places like Tanzania and Rwanda have brought this deadly pathogen back into the spotlight. But with all the information flying around, it's easy for facts to get lost in a sea of fiction. So, in this video, we're going to cut through the noise, separate the truth from the myths, and give you everything you need to know about the Marburg virus. First things first, what exactly is the Marburg virus? It's a severe, often fatal viral hemorrhagic fever belonging to the same family as Ebola. It was first identified in 1967 during outbreaks in Marburg and Frankfurt, Germany, and Belgrade, Yugoslavia, among lab workers exposed to African green monkeys imported from Uganda. Since then, outbreaks have primarily occurred in Africa. Now, let's talk about its origins. The Marburg virus is naturally found in African fruit bats, specifically the Egyptian russet bat. Humans can contract the virus from these infected bats, often through prolonged exposure in mines or caves. Once it jumps to humans, that's when human-to-human transmission can occur. This is where a lot of the misinformation tends to spread. Let's tackle the symptoms first. Marburg virus disease, or MVD, begins abruptly. Think high fever, severe headache, and intense malaise. Muscle aches and pains are also common. As the disease progresses, you might see severe watery diarrhea, abdominal pain, nausea, and vomiting. In later stages, some patients develop a rash, and critically, hemorrhagic manifestations, bleeding from various sites, can occur, though not in all cases. The case fatality rate is high, ranging from 24% to 88% in past outbreaks, but early and supportive care significantly improves outcomes. Now, for transmission. Fiction. Marburg spreads through the air like the common cold. Fact? This is absolutely false. Marburg virus is not airborne. It spreads through direct contact with the blood, secretions, organs, or other bodily fluids of infected people, and with surfaces and materials contaminated with these fluids. This means close contact with sick individuals, especially during advanced stages of the disease, or handling the bodies of those who have died from MVD, poses the highest risk. Healthcare workers are particularly vulnerable if proper infection control measures aren't followed. Let's bring it back to the present. As of early 2025, we've seen significant developments. Tanzania, for instance, declared an end to its Marburg outbreak in March 2025 after confirming cases earlier in the year. Rwanda also experienced an outbreak in late 2024, with health authorities working diligently to contain it. What's crucial to understand is the rapid and coordinated global response to these outbreaks. Organizations like the WHO and Africa CDC mobilize quickly, providing support for surveillance, contact tracing, laboratory testing, clinical care, and community engagement. One positive takeaway from recent events, particularly in Rwanda, is the unprecedented success in treating patients, with some even being extubated, a significant medical achievement for Marburg patients in Africa. This highlights the advancements in medical care and the dedication of healthcare professionals on the ground. So, how do we prevent the spread of Marburg? The principles are similar to other viral hemorrhagic fevers. Avoid contact with fruit bats and sick non-human primates. For humans, if you're in an affected area or caring for someone with suspected MVD, strict infection control is paramount. This includes proper hand hygiene, using personal protective equipment like masks, gloves, and gowns, and safe burial practices for those who have succumbed to the disease. Public health messaging is also vital to ensure communities understand the risks and how to protect themselves. It's about staying informed, not panicking. The global health community has robust systems in place to respond to these threats, and advancements in medical care are continuously being made. And that wraps up our deep dive into the Marburg virus. I hope this video has helped clarify some of the facts and debunked some of the myths surrounding this important topic. Remember, knowledge is power, especially when it comes to public health. If you found this video informative, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe to Azeem USA for more explained content like this. Also, consider buying a super thanks, super stickers, super chat, or becoming a member, which directly supports Azeem USA. Let me know in the comments below what other topics you'd like us to cover. Stay safe, stay informed, and I'll see you in the next one.